And you are a pediatric doctor?
I am a pediatric doctor.
And how long have you been practicing as a pediatrician?
A really long time, over 30 years.
I guess I really want to talk to you about what you do and what you think of vaccines and what you think is causing all this injury.
Boy, those are loaded questions. What I can tell you and what you're actually getting in the interviews is everybody's story. Okay, so I am a board certified pediatrician. I started out the same as everybody else, the same, it's hardcore, you need your vaccines. When I started practice, everybody only got 2 at a time. And I actually began to see problems with it even early on, because when I started practice, we used the original DPT. So kids on monitors, I noticed that they had increased alarms after vaccines. So I made sure that they were aggressive with fever control and things afterwards. And then as time went on, in the late 80s, they started to increase the number of vaccines. And I had a problem with that, because giving just 2 at a time was hard enough, but now they wanted to give 4, 5, 6 at a time. So I made the decision at that time that our practice would only give 2 at a time. So it was never more than 2 at a time. And then as more time went on, I started seeing truly vaccine injured kids. I started seeing a lot of autistic children, and their parents all said the same thing. They said, my child was fine till they got this shot, and then within a week we lost them. Not dead, but they quit having eye contact, they lost language. And I heard that so often. And so then I started doing research. And the more I started researching, the more I found that the ingredients were also toxic. I can tell you today, having been in clinical practice for over 30 years, that the children I see today are sicker than they were when I was a resident. It's like they're genetically weaker. And we give 4 times, quadruple, the number of vaccines that we did when I started practice. And the and there's a sign that's really nice that says by the time your kid is 5, they get 81 different vaccines. It's really 117. And it's not really vaccines, but it's antigens. So like a DPT is diphtheria, tetanus, and whooping cough, and there are 3 ingredients. So you get diphtheria, tetanus, whooping cough. You get 5 of those total. So you get 15 different components there, right? Hib has 3 separate strains, so you get 4 times 3, you get 12. Prevnar has 13 strains of pneumococcus, so you get 4 times 13, 52. When you add all that up, okay, leaving out the flu vaccine, you get 117 different vaccine antigens by the time they're 5. When I started practice, they got 30 to 33. So it's huge. And what I can tell you is from clinical practice, because my field is clinical practice, not research. I've just seen so many vaccine injured kids. It's over and over and over.
So if a parent comes to you, to your practice, and says, I've come for my vaccines, what do you say to them?
They come for vaccines?
Yeah, well, say, I don't know, why do people go to a pediatrician? They go for their vaccines, don't they?
Well, it's more than that. I mean, you could really say, sure, they come for vaccines, and all the well visits are scheduled as vaccine visits, but we're more than that. I mean, they come, at least I hope to me, because in our practice, for its growth and development. And we also take care of sick kids. My practice is integrative, so we do both traditional and non-traditional. In our practice, our policy is we don't even start vaccines till age 1. So, because it's not the kid's immune system until really after 6 months, and it's really not strong till 12 months. So we don't even begin till age 1. And that way I just don't have a lot of problems with them early on. And so many parents come to us because they don't want to vaccinate the traditional schedule with 5 and 6 shots at a time. And so we support what they want to do. And it's turned out really well, because these kids all seem to be much healthier than previous decades.
So if I had my 1-year-old child and I said, I've come in for measles and mumps, rubella because I don't want my kid to die of measles, which is the general thinking out there, would you run through any side effects with me before?
I would tell you that that's all well and good, and I understand and appreciate what you're saying, but we don't give the measles vaccine till age 3. Okay, I won't even entertain it. I would then ask you, what is your problem with measles? What is your fear? What is your concern? And I would educate you on that, because measles, it is a virus, and it can cause problems. It's going to cause more deadly problems in people who are vitamin A deficient, because we know the measles, mumps, rubella shot drains vitamin A stores, and then that creates a disconnect in the brain, and many kids become autistic after that. That's been proven by Dr. Megson. So I just try and debunk what is your fear about measles, because there are alternative ways to treat it that are equally as safe, that bring you through it with no harm.
I mean, I don't think I've ever spoken to a pediatrician that is vaccinating still and that delays vaccines like this. Why did you choose to not give the MMR until age 3?
Because so many children become autistic after the MMR that I believe, before I had the evidence and before Vaxxed came out, that there was a very clear connection. So if autism is a naturally occurring congenital problem, typically shows up by age 2, all right, and the MMR is really implicated, then I just separated them and said, why do it? So initially I wouldn't give it until after 2, and then I just moved it to 3.
So as a pediatrician, what's the top age group that you look after?
Up to age 26, actually.
So therefore you have the Gardasil issue, because I have a huge problem with Gardasil from just reporting of all the deaths and awful crippling. Is this a vaccine that you would give?
No. No. I'm very adamant and passionate about not giving Gardasil. Okay, I did give it to 5 girls initially, just when it came out, and it took me a while, and so I gave it to 5 girls, and all 5 had bad reactions. Fortunately, none of them were lethal, and none of them were long-term crippling, but it was enough for me. And then when I did the research on that, and the last time that I looked at the data, Gardasil had killed 120 girls outright. It has maimed over 10,000. It is causing premature menopause. There's one article I found on a 16-year-old who went into menopause after the Gardasil. It's causing polycystic ovarian syndrome in people. And I actually have a ethical issue with it too, because I go, okay, so maybe there's a population that needs it, but what happened to teaching our kids values? What happened to that? Okay, why do you need a shot? And it just is, in the movie The Greater Good, that was such a really good movie, and that young lady who was probably just the beginning, her story was so awful, and it was so clear it was the Gardasil, that I go, I'm not doing that. Okay.
But as a pediatrician, are you not supposed to follow the CDC schedule?
No, it's a recommendation.
So it's just a recommendation. The pediatricians can do, and that will make sense, because we had one baby, Sebastian, who died at 9 months because he was given 4 or 5 flu vaccines before.
Wow.
And that's clearly not on the CDC
Right.
schedule. And so you don't vaccinate for anybody under 1. Have you seen any injuries from vaccinating over the age of 1? Because we have on the bus. So I was wondering what you're saying.
Not that I can recall from my own practice. I have received patients who have been injured after age 1. Well, yeah, lots of them actually, because that's the MMR is always after age 1. So in that age group of giving it at 12 to 15 months, I think there's probably the largest number of problems with autism afterwards.
So as a mother of a child that's injured myself, and many of the other mothers have the same issue here, is when we go back to the pediatrician with our sick children, they've had either a seizure or whatever from the MMR or whatever it may be, and they have terrible bowel issues and they're very sick, we're told by our pediatricians that first of all, it's not the vaccines, and secondly, oh, that's just part of his autism diagnosis, that he has a diarrhea and bangs his head, and it's just, go away, put him in an institution. That's really what we've all been told. How would you attempt to treat my child if I just brought him in after the MMR and says he's really sick with diarrhea?
Well, yeah, I would. 90% of what we do in medicine is history and physical. And there has to be a temporal association. I have maintained for years that if you brought me a healthy child, I give a vaccine, and within a few days they're back sick, there has to be some kind of temporal connection. Early on in practice too, there were kids that would come back that were ill, and really I found myself saying, oh, it's a coincidence. Oh, it couldn't be the vaccine. And then one day I stopped and went, because I didn't believe what was coming out of my mouth, right? And so I had to stop and think about it, and I went, this doesn't make sense. So you start looking and you start listening, okay? And you listen to the parents. What motivation do you have to lie to me, okay? I need you to tell me what's wrong with your child, and I need you to make connections. I'm also a homeopath, so we do homeopathy, and one of the big things in homeopathy is never been well since. And it happens very often. People will say, I have never been well since I had the flu. I have never been well since I broke my leg. I have never been well since I had a vaccine, okay? And that, it has to be real. It's a very clear point in time. So you're telling me that prior to that flu you had, not even a vaccine, just a flu, you were healthy. Oh yeah, I could do anything. Okay, so then you had the flu, yes, and you got over it, yes, but then you've not been right since, correct? I mean, it's very clear when you listen to people, okay? And again, 90% of what we do is in the history, and the person will tell you, and the body will tell you if you're listening.
Do you worry about the other ingredients in vaccines?
Yes.
Terrible things. You know?
Yes. Okay. Aluminum is a neurotoxin. It's been known to be a neurotoxin for decades. Aluminum and mercury, they've reduced the mercury, that's fine. But they both have, charges. They're like a 3+ electron charge. I looked this up one day. Okay, and so calcium and magnesium are 2+ electron charges. So aluminum and mercury will replace calcium, magnesium, and possibly other electrolytes and elements in the body and create faulty enzymatic and biochemical pathways. So it happens, all right? Polysorbate 80 has been shown to cause reproductive problems. Polysorbate 80, though, opens the blood-brain barrier. So every time you give a vaccine and it's got polysorbate 80 in it, you're opening the blood-brain barrier and allowing the aluminum to cross into the brain more easily, okay? Glutaraldehyde is used for tanning leather. It's got a low vapor point, okay? And when you use cold sterilization, glutaraldehyde, you have to wear a mask, goggles, and gloves because it can be inhaled and cause lung problems. And yet, in small amounts, we inject it into the body. Formaldehyde has never been used for anything but embalming. It was declared a carcinogen in 2011, and yet we inject it in small amounts. And all these things are additive and cumulative. And I think that's a principle that a lot of people may not understand. And I repeat it, it's additive and cumulative. So, like mercury, the old-time mercury thermometers, or one of my favorite movies, Terminator 2, okay, where the mercury guy, and he used to, just go through things and he'd bust into a million blobs and then coalesce back, okay? That's the image I have of what these chemicals do in the body. So you give a tiny blob here and a tiny blob here and a tiny blob here, but eventually they somehow coalesce to create a big problem.
So it must be incredibly hard for you to actually vaccinate someone when you know what's going in.
It is, but it's ultimately not my decision, it's the parents. And all I can do is educate and support.
Sure.
And I do trust a parent's gut. And so I tell them, the thing I require is that you must be at peace about this vaccine. If you are not at peace, I will not give it. If you as parents are arguing about it, I'm yay, I'm nay, and I said, I will not give it. You must come together and be united, or I will not give it.
So one of the questions that people are asking here is SIDS. Do
Yeah.
you have any, because you don't vaccinate in the first year,
Right.
do any of have you had any SIDS?
No.
Bam.
Wow.
No.
How about shaken babies?
I've been blessed. I have not had any shaken babies.
If you were a young mum today, would you vaccinate your baby?
No.
Would you give your children anything?
Food.
But
Love.
food and love, but you wouldn't give any vaccines to your children?
I would not.
Because as we are going around, we are
Right.
seeing the unvaccinated families, and they are so healthy.
I know.
It is. I mean, that's the biggest lie ever told for me. I did not realise that you could be really super healthy
Right.
if you're unvaccinated.
The other thing that I'm seeing, and I don't have any evidence or numbers to back it up, so this is what they call anecdotal or clinical empirical evidence, okay? I've been in practice long enough now that some of my own patients are coming back with their kids, okay? I've been in practice long enough that I can actually tell you that the unvaxxed kids are healthier. I've been in practice long enough that I can also tell you that if the unvaxxed kids are a problem, if my population is a problem, then according to what's out there, they should have a very high risk, and there should be a lot of hospital admissions for my unvaxxed kids getting those things. And I'm seeing the opposite. Okay? They're not. I mean, I've had, some, they get hospitalized, but they've been for, the most recent ones have been for all viral, or they've been for abscesses, MRSA, okay, things for which we don't vaccinate. So the children I have who are unvaccinated are across the board healthier, and I can just tell you that.
It's exactly what we're seeing.
Yeah.
As well on the road.
Can I ask a question?
Yes.
Okay, so we are told that the autism diagnoses have gone up because pediatricians have gotten better at making the diagnosis. Now, you've been in practice for 30 years. Where do you think all these autistic children were 30 years ago? Did you just miss the diagnosis?
No.
What do you think is going on?
It just wasn't there. It
Because
wasn't.
they couldn't have been going to other doctors, right?
Right.
Were there special autism doctors back then that they wouldn't have been going to you?
Not that I remember. I mean, perhaps, but they weren't there.
Can you make a diagnosis of autism?
Can I?
Are you able to?
I'm able to.
So you're not missing autism today.
No.
You're seeing it.
Right.
Where 30 years ago you were not seeing anywhere near as much.
No, it's not. I absolutely was not seeing it near as much. Yeah, I think doctors are more informed, and perhaps we're picking up more because we're more informed. But, they say that about a lot of things. And I go, well, why are you more informed? Okay. We're more informed because we're seeing more of it. But 30 years ago, it didn't exist. So same principle. Things have changed. And I mean, I have one statistic that autism's up 6,000% in the last 30 years. That's not because we're better informed and better at diagnosing. Yes, we are, but we're better at diagnosing because there's more of it. Okay?
Definitely.
Right.
Some doctors want to split the vaccines up to make them single. So single measles, single mumps, single rubella, all that kind of stuff. What do you think about that?
I had much better results when we could do that. Right? We got much better titers, the antibody response. We had fewer side effects. Parents were much happier. February 2009 is when Merck stopped that. All right? And I even called Merck and I said, I have a whole cohort of people who would vaccinate if they could get it separate. And they said, well, we're not doing it anymore. So for those who would say choose to do it, the single vaccines did have fewer problems. So, I mean, would I push that? No. But if you came in and said, I want to get these separate and I had the availability, it is much better than giving the MMR together.
If you were head of the CDC, what are the first things that you would do there?
I wouldn't be head of the CDC.
You just turn the job down?
Yeah.
We wouldn't let you.
Yeah.
We'd make you take that job. I can tell you that right now. But what do you think should be done then, and answer that question? How do we resolve this?
I don't really know. I do think that a whole lot more research or studies need to be done. Like the one thing that has not been done, and it's been brought up in numerous times, is can we not look at the vaccinated versus unvaccinated population? Okay, I know you're going around and you're hearing things like what I say, that the unvaxxed kids are healthier than the vaxxed kids. That's in my practice, but could we look at the whole nation and compare? Could we look at the number of hospitalizations of unvaxxed versus vaxxed? Can you look at, honestly, the exact number of people, say, with pertussis and these pertussis outbreaks? In 2012, 2013, Vermont had a huge pertussis outbreak. 90% were vaccinated. Okay, Reno, Nevada had an outbreak a couple years ago. All of them were vaccinated, reportedly. So, I mean, looking at that, I would think it would be awesome if people would listen to what you guys have been doing. Vaxxed is such a great movie. I loved it. It was so validating to me because it was all the stuff that I had found and researched on my own, but now it's on the big screen and it's unavoidably true.
Why do you think they're censoring vax? It's being censored everywhere, especially in Europe.
Well,
True.
because the truth hurts. Okay?
There's a couple of questions coming in about homeopathy.
Mm-hmm.
Would you recommend that as a possible help for the autistic child that's so sick?
Yes. Yes. We use homeopathy. We use Chinese medicine. There are several things that we do that do help these kids recover. I haven't had any miracle cures yet, but we see steady improvement. I do stop vaccines in all the autistic kids immediately.
So you would never vaccinate an autistic child?
No.
Thank you for that.
And I won't do their siblings.
Thank you.
Yeah.
That's pretty much everyone then.
Yeah.
Everybody just loving you so much, showering you. I don't know what you're getting there, Suzanne, but I am
They're going to be
getting.
banging your doors down
They're
there.
basically absolutely
Where can
loving
I
you.
find her?
There is one question I would like to ask you, and it is a bit of a hard one maybe for you to ask, but we've spoken to paediatricians on the way around, and they've told us that if they vaccinate fully all of their patients, they can actually get quite a lot of money for doing it. One paediatrician actually said to fully vaccinate everybody, he could have 700,000 a year if he really went for it. He hasn't. He's turned that down. As did this other woman. She said, "I don't need it. I'm good." Is this true? Can you make money out of vaccinating?
I have no idea, because that's like, I've only recently heard that. Nobody has ever approached me. I don't have any incentive. I haven't even looked at it.
Well, you don't keep your schedule up, so you're not going to get any money.
Yeah, so and since I can't support that schedule.
You take medical
We
insurance?
do.
Mm-hmm.
But I don't know. I'd have to look at that and see if it was a real thing. But you know what? To me, that's no. Okay, so what does that make me? I get to make $700,000 a year as a pediatrician, as a child advocate who went into this business to help children, and I get to make a lot of money by hurting them? To me, that's just very contrary to everything that I stand for and everything I've wanted to do with my life.
Why do you think so many paediatricians say that vaccines are safe and effective, and they won't even listen to the parents when the parents say, "This vaccine hurt my child," and they say, "No, not the vaccines."
Yeah.
Why is this?
I don't know. I can only speak for myself. I mean, I can tell you that when you come out of medical school and you go in, you believe your training wholeheartedly, right? And then, and I did. And then I started seeing things that, I told you, I started hearing myself say, "Oh, it's a coincidence. Oh, you must have picked up something." And I went, I'm saying that too often. It can't be true. So I started examining it. And then I started listening to what parents say. So, why do they do it? I don't know. I will tell you that in the medical industry in general, I believe there's a huge fear of liability. All right? And it's a litigious society, and many times we don't want to go against what the general recommendation is. So I have found a way to support parents and listen to them, because I'm their guide. I'm not their mother. I'm not their God. I'm a guide. I'm a healer. I'm a physician. I'm a helper. And so how can I help you? And how can we do this together? Right? And can we have agreement? Can we be on the same page? Right? I'm not going to do anything to hurt your kid, and I don't want to do anything that's going to hurt me, and I don't want to be in a position where you ask me to do something and I'm going to lose my license, because then I can't help anybody.
Why do you have no fear of what you're speaking about right now?
I wouldn't say I have no fear. I just know that I'm here to help people, and what I do is working, and I love what I do.